Looking at the patient's chart, need to take a look what is it about this patient so I have an idea what's going on with the patient, and then if there's any questions that I need to ask from the day shift nurse, so we'll just have to talk to each other, get some idea what to expect, and then how to take care of our patients. Very good. Okay.
So we're going to start with. We'll start with Mr. He's not here. 6A. And then we're going to do room 10.
Let me just let you go.
Sure.
You said 6A?
6A.
Okay.
Yeah.
All right.
All right. So he's this gentleman. He's 63-year-old gentleman. Came in last night with a diagnosis of cord compression. He's got a history of bone cancer.
Okay.
He was having extreme low back pain and pain in his legs as well. He was admitted with Dr. Matthews Spine Service.
Okay.
Today he's alert oriented. His vital signs have been stable through the shift. His pain is actually controlled. He hasn't had much pain, limited pain to his back, aching pain, and cramping. He describes it as. He's on IV Decadron, and that actually seems to alleviate most of it.
Can he move his legs frequently?
Yeah, CSM-wise, it's normal.
Okay.
He's voiding appropriately.
Did he work with the physical therapist too?
He's not. He's going to be. He's admitted, and he's going to have surgery eventually.
Oh, okay.
Probably.
I thought they did surgery already. Not yet.
Not yet. Probably tomorrow.
Okay.
So. Right now, today he's had an X-ray, and currently he's down in IR for embolization. So he's been NPO since midnight, and he'll more than likely, you might be able to give him some food for dinner, and then he'll be NPO after midnight again.
Do you know what time he went down for?
Yeah, he just left about 10 minutes ago.
Okay.
Yeah.
That was before 3 o'clock.
Yeah, he's. So he's been NPO all day. He's got IV fluids running.
Yeah, does he void fine?
Yeah, he had I think around 500 out today. Clear yellow urine. No problem with bowel or bladder.
Okay.
Okay, and he's been bed rest. Okay. All right, next.
10.
Room 10. So I'll just give you just a brief update on her, and then we'll go in the room there. This is she's 33-year-old patient with Dr. Matthews.
10? I don't think I have 10. Hold on, okay? Because as far as I know, I only have 6A, 9. I think.
Oh, you know what? You're right.
Yeah,
Liz
10
has 10.
belongs to Liz.
Okay, you're gonna have room 34 then.
Okay,
All right.
so I'll just get report for
Let's
34.
go
34 is on
see.
the other side.
Yeah, that's right.
What's her name?
Excuse us.
Sorry.
Oh, just give me a slap. Sorry.
Ouch.
Where did you go? You wanted the list.
Thank you. We can do that.
I'll give you just a brief update here. Inside. So, room 4034. This is. She's an 83-year-old lady. She's status post-fall at home and suffered a right femur fracture. And she's post-op day 1 from an IM nailing fixation of intertrochanteric fracture. She's also got a history of diabetes and dementia, and CHF.
Is she on
So-
finger stick blood sugar check?
We've been checking her blood sugars.
How's her blood sugar going?
Now let's look in the history here. Don't have the exact result on me. And then we'll go into the room here.
I just
Yeah,
So 169,
169,
140.
140.
Okay.
Yeah,
not too bad.
been controlled.
Okay.
All right,
What is she taking for pain medicine?
let's go in here. We'll finish report there.
Sorry.
Excuse us just for a second.
Thank you.
Just want to.
Steve, we can step outside while they're in here.
Oh, sorry.
It's okay.
Thank you so much.
Go ahead. This is Rowena. She's going to be your nurse for the evening, okay? She's going to be taking care of you.
How are you doing today? How are you? My name is Rowena and I'll be here until 11 p.m. tonight. I will be your nurse, okay? How are you doing right now?
She's
Are you hurting?
Rowena.
No, not really. Good.
I'm going to put your name up here, okay?
Thank you. See your hand? Let me just see your ID band first, okay? And let me see your IV. Oh, here. Okay, can you tell me your full name? Tell me your name.
Let's see.
Rowena, let me
It's
finish.
alright, okay. Alright. I'll check on you later, okay? Let me just finish getting report from your day shift nurse, okay? Are you alright?
So, she's said she has a history of dementia. And, after surgery, she became quite delirious, confused. When I came on shift today, that's actually started a night shift.
Okay, so her baseline is really she's confused.
Baseline is confused, but you know she's became more delirious. Yeah. So when I came on shift today, she's like I said, delirious, confused. She had pulled out several of her lines, her IV site, and her oxygen tubing, and she was very tachycardic, up to 130.
So the doctor is aware of it.
Yeah, I spoke with Dr. Cho. Dr. Cho's aware. We started her on some Zyprexa. She also got a dose of Haldol.
Okay.
We've been giving her morphine for pain, which I've given to her twice.
Is she taking anything for her
She's-
heart rate, like glucose or
She's not on any beta blockers right now. A lot of it, I think, was due to anxiety because when she was calm, like now, her heart rate's 93. So she's been satting 100% on the 2 liters. Blood pressure was normal this morning. Respiration's normal. No shortness of breath, no chest pain, just really agitated and restless. So, as I said, I spoke with Dr. Cho. We got bilateral wrist restraints ordered. She's had that on since this early morning.
Oh, just this morning.
Yeah, around 8 o'clock. And they've been necessary. Every time when we take them off to do range of motion or exercises, she's immediately going to pull out her lines. So
Does she have a Foley?
she's got a Foley, and she's had good output today, around 300 clear yellow urine. She has normal CSM. She's able to move her feet there.
Okay.
She's essentially been NPO just because of her aspiration risk at the moment. She hadn't been able to eat or take her pills. So
Most of her IV, most of her medicine is through IV.
yeah. Her labs are stable today. Besides her calcium, it was 6.6 this morning, and we gave her dose of calcium gluconate replacement. So
Oh, she had calcium gluconate. When? Today?
today.
Is there any order for repeat afterwards, or just
No.
that's in the morning?
They may check
yeah,
it in the
was
morning.
6.6 this morning. Oh, yesterday.
It was actually in the evening. But she was,
Yeah,
because she was
10:30.
unable to take her calcium tablets orally, we had to give her the IV. So, all right.
All right, thank you.
So main things for her, obviously pain control, eventually getting her to use her incentive spirometer, getting her out of bed, and monitoring her restraints and her agitation
I don't
level.
want to wake her up. She fell asleep. I'll just check on her later. Okay. Thank you.
All right, you're welcome. It's fine. Liz, 10, 12, 37.
Are you hurting? Huh? You're not bleeding. Are you having pain? Yes, you are. She can. Crumbed and applesauce. Did she eat? She ate. The daughter fed her lunch. But then at 2 o'clock when I came back, when I turned her and skin pictures. Lola, she's gonna give you pain medication then. Okay? Okay? Alright. First time ko pong pero kagabi tulog daw siya. Gamang. Kaninang umaga, gising siya. Pero yung sinalaw ko, sumisigaw sa sakit. So, binigyan ko siya ng norco. Hanggang ngayon, ganyan. Sedated na siya. Pero andito si Carmen, si Carmen.
Reklamo niya, lagi may sakit.
Sabi niya kanina, hindi masakit pag hindi mo gigalaw. Pero ngayon, pag tinatanong mo, sabi niya, she's ready. Did you talk to someone about doing catheters? Yes, before. I thought he said, I'll put a deal. Okay. Right. Yeah, but his, bill is so I'll be back, okay? All right.
Hi, Liz. Hi. I've got 2 patients for you.
Okay.
Room 10 and room 35, I believe.
All right.
Okay. So starting off room 10 here. She's a 33-year-old female patient, Dr. Matthews. She's got a history of spinal fusion. She came in for an L5-S1 removal of bone plate and some screws. That was done yesterday, so she's post-op day 1. She is, we can go in and I'll give you the rest.
Okay.
Hi. I'm going to be leaving. This is Liz. She's going to be your nurse for the evening, okay?
Good. How are you?
All right. So I'm just gonna finish giving a report, okay?
Oh,
so,
okay.
Yeah. So as I said, she's post-op day 1. She's been alert and oriented ×4. Vital signs have been stable today. Let's see. She's biggest things. Her catheter came out this late morning. She's voiding appropriately.
Good.
She still has a hemovac drain. There was 20 cc's output from that, bloody. And she's now saline locked.
Okay.
She's taking a regular diet. She's using her incentive spirometer. She's been up walking a couple times today. And the biggest thing for her right now is pain control. We've got her on Percocet around the clock. Actually, one tablet around the clock now, every 3 hours. And
Does
then
that seem to be working?
Yeah, well, between that and then the one
She's
that they give me through the...
yeah, she's also got Valium as needed, TID. She got 1 dose of that this morning. And then she has dilaudid 0.8 milligrams every 2 hours PRN. And we gave her 1 dose of that. And last time she got her Percocet was 1430. So,
Okay.
other than that, I think, yeah, she's doing pretty. Oh, the other thing was she didn't get any sleep last night, so we got her some Ambien ordered
Oh, good. Okay.
tonight. So hopefully that'll work.
Good.
And so, so next shift, the goals: keep your pain controlled for you. We'll continue using that incentive spirometer.
Yes.
Okay, and maybe do another getting out of bed, another walk. Okay. Her CSM is normal, and her pain is pretty much located to her lower back. So,
Okay.
all right.
All right, and I'll be back after record, okay? All right.
All right. Have a good evening. Okay. All right.
Okay.
And this. Put the layers in there now. Surgery. All right. So this is, and this 22-year-old female, primarily Spanish speaking. She was admitted a couple days ago for abdominal pain, nausea, vomiting. They're not certain exactly what's causing it at the moment. She's had a GI consult and most recently a surgical consult. Possible initial thoughts were some gastroenteritis, maybe intussusception, or maybe bacterial in nature. So what we're really waiting for is, I guess there's some thickening of her abdominal, was it? Sorry. Yeah, thickening of her small bowel. So surgery was consulted and just kind of waiting to see what they have to say. She's been NPO since midnight. So one of the things we can go in here and finish up. Hello. This is Liz. She's going to be your nurse for the evening, okay?
Hi.
I was just finishing giving her a report. So she's been NPO since midnight. We're kind of, like I said, waiting to see what surgery has to say. Might be able to get her a meal for dinner if something's going to take place tomorrow.
Okay.
She has had a bit of pain this morning. It's kind of aching, cramping pain to her abdomen. She's been getting IV dilaudid to help alleviate that, and it works pretty well for her. She's only needed 1 dose this morning. She had 1 bowel movement early on. She does have some orders to get specimens, a stool specimen,
Okay.
and parasite, and I believe an occult blood for that as well. So she's alert and oriented. Vitals are stable today.
The MRSA, was that done? Do you
The
know?
MRSA was completed, yeah. She gets up, she walks a bit. She was started on antibiotics today, Rocephin and Flagyl. So
And she voids.
she voids, yeah.
Okay.
Okay, Mr. I'm going to be leaving. Liz is going to take over for you, okay?
How's your pain right now?
There is no pain.
No pain? Okay, good.
All right. You have a good evening, okay?
I'll be back shortly, okay? All right.
All right, any questions?
No, sounds good.
Okay.
Thank you, James.
Uh-huh.
Susie,
Soul
right?
Corner, yes.
Okay, I'm Pa. I have 4 patients for you.
Okay.
Let me log on real quick.
24, 27.
24A, 24C, and 27 and 30.
Okay.
Okay, so let's go over here. Patient's sleeping right now, so. Okay, we'll do it right here so we don't wake him up. 24A is Miss Eliza Chan. He came on the
Or
2nd.
24A? I think I have 24C.
Don't you have 24A and C?
A and C?
She gave you all my patients. She should have given you all my patients. Let me go talk to her, make sure it's correct, because she wants to.
And I was trying to be here. It's not.
Let's do 24C. Let's do these one first. Okay. So 24C, he came in on February 2nd. He had a complete thyroidectomy. Dr. Carr's patient. He had an incision right here across the neck, and staples and 1 JP. The drain put out 20 for me. Okay, they took out his Foley early in the morning, and he has been up, ambulating, voiding lots of pee, so we don't have to worry about that. He's on a regular diet, tolerating diet, no nausea. He has ACNHS finger sticks, no coverage, 108 and 137. And then they gave him some Norco in the morning, and it gave him a little bit of a headache, so he doesn't want Norco. I gave him some Tylenol earlier. So here's the pain escape paper for him.
Okay.
So he gets Norco every 4 hours for pain, but he doesn't want it. And he gets Tylenol for mild pain. I gave that to him earlier.
Okay.
He said if he's asleep, don't wake him up.
Okay.
Okay. So, want to go and check up on him real quick? Let's see, anything else I need to tell you about him? Nope. He's probably going home tomorrow, and his calcium is 8.5. And the doctor came to see him already today.
Okay.
Let's go check up on him real quick. Okay. We're just gonna check up on you real quick.
Susie, I'm going to be your night nurse. I'm Susie, I'm going to be your night nurse.
He's hard of hearing.
I'll be here all night with you, okay?
Oh, okay.
Okay, so right here is Rob.
Okay.
And just change your name up there.
You have a pen?
I do have a
I
pen.
have a pen.
Here.
Great, thank you. We're going on the 3rd, right?
Yep. Actually, the 4th.
The 4th?
For you.
Day behind. That's Friday.
Okay. All right.
Okay. I'll be back in a bit.
Okay.
Okay. Ready? Okay, so that's the one for him. And then this one is Mr. Let's go over here. He's probably sleeping. So this is 48-year-old male, Dr. Murmur's patient, came in for a lumbar fusion on February 1st. He has a large dressing this big on the upper back with 3 hemovacs coming from it. And the hemovac number 1 put out 20, number 2 put out 40, and number 3 put out 10. Still bloody looking.
Okay.
He has a Foley, lots coming out of the Foley.
Okay.
He has a TLSO brace that he has to wear when he's out of bed. We got him to sit earlier for about 30 minutes, and that's all he could tolerate.
And that was that the first time he was out of bed?
No, that was the second time. He's out of bed with PT, with physical therapy, because it's so hard for him to move.
All right.
He does have a dilaudid PCA, 0.2 milligrams every 6 minutes with no continuous. Okay. I did start him on a pain pill, oral pain medicine. I gave him 2 Percocets at, here you go. 2 Percocets at 1939, and then he said he does not want to be waking up for pain medicine. So then he still has this, and he only used a little bit of the, and he has this IV fluid running. You can have that.
Thank you.
Let me see what else I need to tell you about him, Mr. Okay. Yep, that's pretty much it with him. He likes to be turned, and he'll call when he wants to be turned. He can help you with turning, but he wants to just be a little bit more comfortable.
Okay.
His labs were 12 and 37, and potassium was 4.3. Okay, let's go. We have a handoff to do in there, so I'm gonna sign on real quick. Okay, so it's kind of,
I know he's got a lot of ZP.
okay.
Good evening.
Hi, I'm gonna go home. This is Susie. She's coming on. She'll be taking care of you. Okay?
Okay, I'll be here tonight with you.
Let me see. That didn't work. There you go.
I need to go home.
Hmm?
I need to go home.
You want to go home?
I want to go home too.
I'm gonna put your pain button right here in your hand so you can use it. Okay?
Okay.
Okay. Have a pen on me.
Yeah, I do.
Just hold on to it till we're done.
Yeah.
Thank you.
You're welcome.
We haven't been here for a while.
Okay. So, excuse me. Does it work? Okay. So here's the setting. 0.2, 6, 10. Okay. I've already cleared it for me.
Okay.
So we're just see how much is left. 29.
Okay. Great.
Hand off. Credit. 29 milliliters. Okay. Okay, that's yours. It's hard to see.
I need to get myself a flashlight.
Yeah. Okay, that's it. And you still have, his bag is still good for you. Still have
Okay. There. Great.
Okay. Then we have one more, 30, right?
Okay.
Okay. So this is a contact room. He's on contact for MRSA of the abscess. So I'll let you know. This is Mr. He came in on the 26th for right below the knee amputation. And then on the 28th, he went back in for a stump repair, the same amputation leg. So right here in the leg, he's got the stump here and then gauze and ACE wrap. And it's elevated on a pillow for him.
Okay.
Okay.
So that was the 26th was the original one.
Yeah, and then the 28th is the revision. In addition to that, he also has other skin issues. He's on an Envision bed. Okay, so his skin issues, he's got on the left buttock, he's got a little skin tear. So earlier I changed the dressing, put a Mepiplex on it.
Okay.
Mepiplex on it. Okay. And then in addition to that, he has these abscesses in his arms right here. They pack him and then they cover it with gauze. Their wound care sees it Monday, Wednesday, and Friday. So they already did the dressing change. The dressing changes every day with nurse or with wound care when they do it.
Every day. Okay, so we do it on the days that
Day shift.
Okay.
The doctor came in and saw another abscess here starting to grow. He's had these abscesses before, and they don't know why.
And what's causing them, huh?
They don't know why, so it's a big abscess, and so tomorrow he's going to go in for drainage, IND, of that abscess.
Okay.
So he is NPO after midnight tonight.
So it's just for that one on his right arm?
Yeah, on the right arm.
Okay.
That one right there. Alert and oriented, real nice guy. He has finger sticks, AC and HS, 330 and 193. So he gets Novolog and NPH for that.
Okay.
Okay. And he's got some edema in that left leg and in the scrotal area, so we put ice packs to the scrotal area.
Okay.
Okay. He's got a triple lumen in the right neck right here, right IJ, saline lock. His vital signs have been good, afebrile. We do have some orders for you. At midnight, you're to start this IV fluid.
Okay.
And then at midnight, he's to be MPO. Nothing.
Right.
And he can get this as needed, but most of the time he doesn't need it.
Q4.
Only for dressing change. Okay. They put him on this one and this one around the clock, and he's been doing really good on these pain pills.
Okay.
Okay. And that's for you. And we'll have to gown up to go in there. Sorry.
Thank you.
You still have my pin?
And my,
You still have my pin?
I do.
Okay.
Yeah.
All right.
After the baby things, I'll probably need it.
You think that one over there? Gotta keep it. He's still awake. He had a bowel movement earlier. He used the bedpan. Sleepy. Okay. I'm going to be going home. This is Susie. She's going to be taking care of you,
I'll be
okay?
your night nurse, okay?
Okay.
Okay.
And then... Remember, nothing to eat after midnight, okay?
Yeah.
So you have a little less than an hour. I'll be back.
Okay.
Okay, this is when I did the report.
You have to come hide his stash, she said.
Oh, is that what you said?
Yeah.
Okay.
Okay.
Great. Okay, I'm gonna finish getting the report and I'll be back to check out, okay?
Okay, I'll be here.
Okay.
Thank you.
Thanks.
You're welcome. Okay, so that's it for you.
Okay, thank you.
You're welcome.
Good morning.
It's just mild or beautiful restaurant. This would be important.
Yes, I'm out here. I'm sorry? I'll be right back.
Yeah, yeah. Completely.
So he finally decided to transfer. Okay, now touch this, okay? No wonder. No, since it was
sir. See you later, okay?
So we probably want to go in 24th.
Sure. Okay. So 24C, he's hoping to go home today. A total thyroidectomy on the 2nd. 70-year-old gentleman, ambulatory. He's saline locked on a regular diet, and he even had a sandwich in the middle of the night. He felt a little bit more stiff in the shoulder area last night, so I gave him a Norco once for that. But his incision looks great with staples. He had 2 JPs to start. The left one's out. He still has one on the right, and it put out like 18 last night. His AccuChecks AC and HS. Vital signs were good. His calcium was 8.5.
Oh, last one, okay.
Last I saw, yeah. Okay. I'm gonna go in and read them.
Yeah.
Okay.
71.
Okay. He's hard of hearing.
Oh, yeah.
Morning.
Good morning. This is your day nurse.
How are you? Doing better?
Oh, yeah.
Sorry to wake you up. Okay, I'll come back later, okay?
Okay.
And the pain pill worked well for the pain, for the shoulder pain?
Yeah, it's starting up again.
It is starting again? Okay. She'll take care of you when she comes back around, okay?
No problem.
Okay, nice to meet you. I hope you get home today.
Okay. Thank
Okay,
you.
And
you're welcome.
You have a call light right there, call light? If you need
Yeah, I
help.
got it right here.
Okay, and the phone?
Yeah, I got a cord right here.
There you go.
And the phone is right here, okay?
Telephone's over there.
All right.
Okay,
All righty.
have a good day.
You have a good day, too.
Thanks. Okay, so you have 27, and you don't know any of them, do you?
I had 27 yesterday.
Did you?
Yeah.
Okay, so we have a handoff in there. So he had the lumbar fusion on the 1st, and so what's probably new for him, he still has the 3 hemovacs and the dressing in the back, which looks good. Still has the Foley catheter, which is draining plenty, 1350 out last night. He did get up with PT, so he's been up out of bed for about 30 minutes total with the brace. He feels like he said, you know, he slept really well last night. He feels like he's just a little bit weaker this morning, just a little tired, probably from getting up yesterday. Has a CPAP machine, but he didn't wear it last night. And he's got the Dilaudid 0.26. Regular diet.
0.26 and 0, okay.
Yeah, and they started him some PO pain pills, but I didn't give him any last night. He didn't ask for anything. He slept pretty well. He still has the IV going at 100. I have normal saline with 20. And no complaints. They just turned him this morning to his left side. He kind of had, you know, favored the right side last night. He was sleeping really well and didn't want to be turned, but they turned him this morning. So we'll do the handoff. Let's see.
Good morning, Gavin. How are you doing? Nothing. Oh, it's okay. Do you have the play button right here? Okay, right there. Okay. You want to press one more time?
It's not time yet.
No time yet, okay. So later when I come, I'll try to see if I can give some oral pain medicine, okay?
Because they had started you on some pills, pain pills yesterday, and that worked pretty well for you.
So you remember me from yesterday, Sindhu, okay? I'll get this, okay? So I'll write my name right here. Today is Friday.
It's Friday already.
Yes.
Wow.
So hopefully physical therapy is going to come, you know.
It's Friday already.
Yes.
Did you lose a couple days?
Somewhere along the line.
Quick week.
Yeah, it was.
Okay. So 0.26.
Okay.
Okay.
I don't know, those things aren't moving on my legs for some reason.
Oh.
They're off for right now.
Oh, are they? Okay.
You ready to have them back on again?
Yeah, it's gonna make you feel
Remaining 22. And I cleared it earlier, about an
I'll
hour
come back,
ago.
I'll put the leg thing on, okay?
Thank you.
So he had a good night. Slept well. Okay. Have a good day. Good luck getting out of bed.
You have the call light, everything right with you? Right here, okay? Call light. Okay. All right.
Okay. And do you know the gentleman in 30 at all? Okay. So he had a good night too. He's been NPO since midnight. He's going to be going to surgery for an IND of a new abscess that's starting in his right, like antecubital forearm, you know, upper arm. So he's been NPO since midnight. I started an IV on him, D5 normal saline at 75, and he's got the right IJ, the triple. So he's contact, he's MRSA, and that was from an abscess like an 05. But they did write that he could have some meds, so he got his amoxicillin and his Lasix this morning.
So do you know what time they're going to do the IND?
He said they didn't know, they were just going to kind of try and add him in, so probably not early. I started the pre-op checklist, consent's been signed, it's in the front of the chart. But his right leg, you know, is nicely wrapped still, no sign of any drainage or anything like that. He had a large bowel movement this morning, and I put fresh ice packs because his sternal area is very edematous, and that's happened since he had the surgery on his leg. His niece is in there. She spent the night. And I gave him a Dilaudid twice, 0.5. And most recently, just this morning, about 6:15. Okay.
Yeah, I know him.
Yeah. I'm going to say hi.
Thank you very much.
You're welcome. I didn't check the surgery schedule, but he said it was just going to be kind of fit in when they could today.
I usually do at 2 o'clock.
Oh, that's what time you've been doing it?
You want that,
The wound care nurse is not doing it?
No, we do at 2 o'clock and then, we do for the physical therapy. So it works better.
Okay.
I'm going to be a nurse for today, okay? Still sleepy? Okay.
Did the pain medicine start working on you there? Okay. Yeah. Good. Okay. And it's not anything related to his leg this morning, the pain. It's all his arm for what he's going for, right? So he's got the dressings still wrapped, so I haven't seen it, but you've seen it already.
So make sure don't eat anything, okay? NPO? Okay, alright. Don't even water. Okay. Alright, so if I know the time, I'll tell you, okay?
Alright, thank you.
Okay. Have a good day.
You too. Thank you very much.
Call me
You're welcome.
Call me if you need any help, okay?
Okay.
All capitals.
Yeah, make it a little bigger so they can see.
Yeah. Okay, so that's all that we have together, right?
Uh-huh, yeah.
Okay.
Yes? Yeah, sure.
Where's Ivy? We've got. Is she over in this corner?
There. Give it to Ivy.
No, you got 28.
I have one more.
A handoff in there. That's okay.
Yeah.
I'll finish my charting.
There. Okay. 14.
You know what? Thank you for
Oh, thanks for your help.
when they're in the, the old drawer, the old pushing or whatever, but once they're done, they're done. I did see this. You were not very fast because I saw it. You said it. I saw it out in the paper. That's all I read. That's all late.
Do anyone know how to print a surgery schedule like on one paper? Because when I do mine is my one signature.
I've never
You know how? Yeah, because I did it once before. Alicia showed me, but I
not go on paper. Yeah, I never
It's
seen that
either
one.
one or two.
It's usually like a whole bunch of pages, but it's just all the surgery. Maybe they just do schedule.
All done?
Can I help you?
Good. Filming. Who are you here to see?
Some Miss Carter on yours.
Okay.
Can I help you?
Head.
Yes.
You can go in there, Phil. What room? 19. Shiny release. No? Where's the patient that was in 19C? Did she get moved? 20. She's in 28. They were creating a private room this morning for. Yeah.
Thanks. That's nice of you. Thank you.
Even some more juice.
Good morning. Think she might go home today?
I think so.
Okay, good.
She's doing great.
Good. Okay.
Thank you.
Sure. Okay. I live close. You can. It's okay. Okay, one more. Oh, did you? Okay, and the doctor was in this morning. She might go home today. There she is.
Hi, good morning, Dr. I think she's doing really well. I think she'll be
Good.
okay.
Good.
Yeah. So I had her yesterday. Dr. Kinney will be by this morning also.
Okay.
Thank
We'll
you.
just wait for the order.
I'll put it in.
I'll ask Dr. Kinney if she can go home. Okay.
Okay, so you had her yesterday. So they moved her, from 19 to here. Was that on your shift yesterday?
Yes. Yeah, in the afternoon. It's
Okay. Yeah, so one more stool collection, but if she's going to be going home, she didn't have any.
Already?
First, they sent one.
Okay,
They did.
one. Okay.
So, yeah, and she didn't have anything but just a smear last night.
Okay.
So, she's independent. She walked in the hallway twice last night. No complaints of pain or nausea or anything. I think she had a little bit of applesauce this morning.
Okay.
Her vital signs were fine.
Pain-wise, giving something?
No, she, denied pain twice.
Okay.
Just a little poor appetite on PM shift. She wasn't really interested in eating anything. But yeah, her steri strips look good. She still has a saline lock in her right hand.
Yeah. Okay.
Yeah, no problems. Thank you. Yeah, these two. And one, you have on the other side? Yeah. Keeps you busy.
You sent, right?
They did yesterday. They sent one yesterday. She didn't have any last night.
Oh,
And he
so
belled with me yesterday.
I'll get it.
Okay. You're gonna have Ivy. She was here yesterday.
I feel so much better today.
Much better?
I
Okay,
get
good.
to go home,
Oh,
Yes,
good.
Yeah.
but I would like to take a shower.
Yeah, you can
Very
take
good.
shower. I have the order to take shower
Yes.
already. But what else? No bowel movements since
No,
last
just
night?
a little.
Just a little smear
Yeah.
last
When we
night.
have this morning, I'll put another hat there and
Okay.
then because we need one more. Because I know you're negative. Our protocol is if it's negative, we need one more to actually it's negative.
Probably because I haven't been eating much, just very little.
Okay, how's the pain?
No pain.
Oh, good.
Yeah.
Because I think yesterday it's really like
Yeah.
hyperactive in your
Yeah.
stomach. That's why
I
we
feel
feel
better
pain.
today.
Okay.
Good.
Okay,
Okay.
ma'am.
Okay.
Good luck getting out of here. I'm leaving. She's coming on.
Yeah.
Okay.
And
Okay,
Holly will
nice
be
to
my
meet you.
partner for today.
Okay.
Kim, okay? Kim, okay?
Okay.
I'll put my name
I
here.
thought they were gonna film you.
They are.
Oh, there you
Do
Okay.
you have a pen?
Yeah.
Okay.
Thank you.
Okay. Have a good day.
Thank
Good luck getting out of here. Enjoy your weekend.
You sleep well last night, ma'am?
Well, I was up.
Yeah, you were up a decent amount, huh? Walking. She walked in the hallway twice.
Oh, yeah.
Yeah. Yeah, she's up. Okay.